Okay, now we'll have a look at the morphine mechanism of action. Now, mechanism of action: morphine and other opioids exert analgesic effect by interacting with opioid receptors on the membranes of the neuronal cell in the CNS and other anatomic structures such as smooth muscles. Now you can see here the therapeutic uses of morphine are analgesia, treatment of diarrhea. Morphine is a prototype agonist. Opioids are used for brain trauma, cancer, and other types of severe pain. Opioids will decrease the motility and increase the tone of the smooth muscles. Cough. Morphine suppresses the cough reflex. But codeine and dextromethorphan are more commonly used. Treatment of acute pulmonary edema. IV morphine will relieve dyspnea caused by pulmonary edema. Anesthesia. Opioids are used as pre-anesthetic medications for systemic and spinal for post-operative analgesia. Now, analgesia: morphine and other opioids relieve pain by raising pain threshold at the spinal cord level. Now, this is a comparison of efficacy. These all have higher efficacy than this, and the codeine is the lowest efficacy. Now, morphine is also used for euphoria. It produces powerful sense of contaminant. That's why it is also abused. Respiration: it causes respiratory depression by reduction of the responsiveness of the medullary respiratory center neurons to carbon dioxide. Now, depression of cough reflex. Morphine and codeine, they are all antitussive. Meiosis: this is a characteristic feature of morphine, and often you can see the toxicity. This is meiosis constriction, pinpoint pupil. Now, emesis: morphine directly stimulates chemoreceptors trigger zone. GI tract: it relieves diarrhea by decreasing the motility. It produces constipation, little tolerance. Now, cardiovascular has no major effects. Histamine release from mast cell causing urticaria, sweating, and vasodilation. Hormonal actions may lead to opioid induction and androgen deficiency. Now, these are sexual dysfunction, fatigue, hot flashes, depression, weight gain, decreased muscle mass, osteoporosis, and possible infertility. These are all symptoms associated with OPIAD, opioid induced androgen deficiency. Now, labor: it can prolong the second stage of labor. Now, pharmacokinetics: oral administration is slow. Extended release preparations are present, and subcutaneous and IV is also given. Distribution: it rapidly enters all body tissues, and it undergoes glucuronic acid in the liver to 2 metabolites. Adverse effects are common: opioid induced constipation, respiratory drive may be suppressed in patients with respiratory disorders. Hypotension, dysphoria, sedation, constipation, urinary retention, nausea, and potential for addiction. Now, tolerance and physical dependence: when you will use it repeatedly, the repeated use produces tolerance to the respiratory depressant, analgesic, euphoric, emetic, and sedative effects of the morphine. So, tolerance usually does not develop to meiosis or constipation. Physical and psychological dependence occur with morphine and other antagonists. Withdrawal produces a series of anatomic, motor, and psychological responses that can be severe. Now, drug interactions. Drug interactions are possible. CNS depressant drugs such as phenothiazines, MAO inhibitors, and benzodiazepines.